This presentation concerns using CloudPAT to do an interpretation for a WatchPAT study. The first thing to do is to open a browser and type in cloudpat.precisemd.com and enter. In this case, my username and password already populate, but if they're blank, it's typically your first name dot last name dot s and the password that you assign to this account. And then click on the sign in button just below the word password. Once you're in the account and it fully loads, you'll notice how many patients that are waiting in your queue for you to complete. In this case, I have one, and in order to open the account, I click on the patient ID. The first thing that opens essentially is the area that I'll complete the diagnosis and recommendations with the templates that I've already created. But in this case, I'd like to go ahead and click on Open in Viewer first, because what that will do is open up the raw data. Open CloudPAT Smart Client. That'll open that so I can review the raw data and see if there's any additional changes that need to be made. I'm clicking back on the browser window, and now I can click on the word Preview. The patient sleep study report opens up, and I've enlarged it to make it easier for me to read. In this test case, this patient's name is listed here, along with his neck circumference, his body mass index, Epworth if we had it, mobile phone number, and address. We continue to go down and see when the study was completed, who the potential referring physician was, and any additional medical history that may have been inputted at the time that the study was sent to you. If I continue down, I'll see on the sleep study report when the study started and it ended and the total recording time. Below that is the total sleep time. We make special recognition of this because it will take out the period of time that the patient was awake during the study in order to not dilute the AHI. We see below that the respiratory indices and typically go right to the AHI, in this case seeing that it was 59.2. We also list the RDI, the ODI, and the potential central events that this patient has as PAHI small c. And in this case, we see it was 28.1 per hour. Additionally, a percentage of CSR, Cheyne-Stokes respirations, listed at 67.3. If we head to the right-hand column, we see oxygen statistics, we see oxygen saturation levels, and pulse rate. If I continue to scroll down, I see my hypnogram information concerning the number of events throughout the night. Each one of these would be a blue marker, so this patient had significant events throughout the night. The next hypnogram below, it talks about snore and body position, which is overlaid. So all the goldenrod color is snore, and the black line notes that this patient spent a significant amount of time in supine. If we continue down, we see oxygen saturation and pulse rate in a graphic format. And then below that, the wake sleep stages, any red-topped areas where the algorithm determined that the patient was in REM. If I continue down to the third page in the sleep study report, I see body position statistics, and again, this patient spent the majority of his time in supine. Snoring statistics are below that, as well as the sleep stage chart that shows the patient's wake versus sleep time and their sleep staging in a graphic format. Below that is essentially the green to red bar, and in this case, the patient's AHI goes all the way out to 59.2. I can minimize this at this time. I can go back to the patient study and see that the raw data is populated down below. And if I click on the icon, the raw data will open up and look through an hour segments to determine the sleep staging. And then I can select it in 5-minute window to determine if there's any events that I'd like to have a closer look at. If I made changes within the scored events, I can click on File and click on Save Study Results. It'll ask me if I'm sure. I click Yes. And now all my changes have been saved for my final report. I can minimize this or close out the record if I'm done with it. Knowing this study was abnormal, I'll click on the categories for statistics and choose abnormal. At this point in time, I'm going to go ahead and open up the diagnostic template and select a value for this. In this case, this patient obviously shows signs of a severe obstructive sleep apnea. I click on that, and it pre-populates my diagnosis. I continue on down and select the recommendation, and I see that I have one for sleep apnea severe and click on that one. It also pre-populates that block for me. If I wish to make any additional changes to this or add any additional notes, I can do so by freely typing in. Once I'm close to being done with my report, I can click on Save. Any changes that I've made are now in the record, and I can click on Preview to see what my report will actually look like. I now see on page 1 that the summary and diagnosis and recommendation blocks have been filled out. If I'm satisfied with that, I'll minimize the record or close it out. If I'm satisfied with the report, I click on the NPI and go back to the top. Once I'm fully done with my report, I can click on Save and Lock, and at this point in time, the record will no longer be editable. It'll close it and take it out of my queue. It sends an email back to the person who originally sent me the study for interpretation. The record is saved. Thank you for watching, and if you have any additional questions, please give us a call at Itamar at 1-888-748-2627. Thank you.